Hi, I'm Shannon, and I just want to take a minute to talk about what I'm seeing as an elder law attorney with the current staffing shortages that we're seeing in healthcare facilities, and what that can mean for our clients and for patients and for people who aren't our clients, and the importance of strong healthcare advocacy when we have a healthcare event that puts us, either in a Medicare rehab bed, which again we want to make sure that we get 100 days after we are discharged from a hospital stay. I want to continue to get that physical therapy, occupational therapy, continue to rest and recover, and that means that we need to advocate for not being early discharged because they don't understand the standard. And the standard is, and I know I'm going very fast, but you can look at some of the other videos to get some more information about this. But I want to make sure that you are recognizing that the standard is the therapy causing you to decline? Is the therapy you're receiving causing you to decline? Only if the therapy you're receiving is causing you to decline can they remove you from that rehab bed. Okay, so that's another issue that I'm seeing quite a bit. And then of course, the problems with Medicare Advantage plans, things not being covered. Also with Medicare Advantage plans, having to get pre-approval for different procedures that then are not covered or denied. Understanding that the process for pre-approval, there's an incentive usually on the reviewer to disapprove any procedure that you're requesting approval for. And also that, just understanding the business model for Medicare Advantage plans versus traditional Medicare. And then also understanding how you can get back on traditional Medicare. And I would encourage you, if you have options to get back on, there is, this new process of using a change in circumstance. So, if you have, a big medical event, there are options for you to also get back on traditional Medicare. You just have to go through that process, and sometimes it can be challenging to understand that procedure. So again, I invite you to maybe speak with a healthcare advocate about that. And then, really the staffing shortages are creating a problem with patient care and management. And we have to be assertive patient advocates, meaning that if you're a healthcare advocate for someone or a healthcare surrogate, you need to be strong. We're nice people, right? We don't really like to make a fuss. We don't want to assert ourselves. And there's this idea, and let me bust this myth for you, that if you assert healthcare rights, that our person will get worse care or treatment. And I can tell you from my perspective that is not the case. The more that we assert that, our person with a bed sore needs to be repositioned every 2 hours, and that the standard of care, when we ask for things like care plan meetings, and we have an opportunity to speak directly to the doctor, tell them about our concerns, what I see in my practice is that our person gets better care. So being a strong healthcare advocate, asserting the rights of our patient often leads to a better quality of life and a better quality of care. And that becomes so important to people who are struggling and suffering and in pain. We oftentimes will have to really assert their rights in order for them to get good quality care today, because staffing is so short. And it's not the fault of our patient, but oftentimes we'll see that the person who doesn't have an advocate who's strongly asserting for their needs will end up with the worst care. So, and I can talk about what to do if you don't have a healthcare advocate, if you don't have a surrogate who can step in and kind of say like, hey, my person needs to be repositioned, or I need to be repositioned, but maybe your voice is very unheard. So I'm going to talk in another video about that and that struggle. And anyway, I just wanted to really talk about what I'm seeing right now at this time, and encourage you, be strong on your advocacy for yourself and also for our loved ones. All right. Have a good day.